currently America is undergoing a huge transition of a new presidency. So I was just kind of curious, seeing as how the previous president was handling it before, and now the incoming one has a different plan and an obvious different approach. Are you thinking things might change?
Yeah, I am definitely thinking things will change, especially considering, the previous administration didn't really have a response and their handling of it was to not. And I think the fact that, the new administration has a COVID task force that is made of nothing, composed of scientists, doctors, immunologists, infectious disease doctors, and nothing else, I think that alone is reassuring. So I am very hopeful about this new administration. However, inauguration isn't for another month, and things are only getting significantly worse by the day. Mm-hmm. It's not just that things are getting worse; it's the rate that things are getting worse is, I think, really scary. And so I do have, I think, a fear of how bad things will be before the new administration is able to put things into effect. And I know there's a lot of hope surrounding the vaccine, which I also am super hopeful, super excited about it. I will definitely be getting it as soon as it's available. But there's no guarantee that the general population will, which is what it's going to take for us to get back to normal. So I'm cautiously optimistic, I would say.
And I know too, with this vaccine, it's going to take 2 doses. So people, I feel like I've had like such a hard time wrapping my mind around this whole vaccine, because I feel like I've been naive before with, vaccines, because they were just always readily available. Now we have this new vaccine. We're still trying to understand it. And, it's, now we're going to have to take 2 doses of this vaccine, but still also take those other precautions along the way. So it just makes me wonder how it's all going to play out, and so I don't know.
It is kind of a logistical problem and a public health problem, because with flu campaigns, we kind of just go out in a community and we do what we call a blitz. Is we just go with the flu vaccine, we just give it to everyone, and then we of course obviously we keep track of it and we chart it, but it's a little bit lower maintenance because we can just say, okay, we got that community, we're done. With this, you have to keep track of who got it and when they got it, and then you have to do follow-up. And, when you're giving a vaccine on this scale to this many people, that's not an easy thing to do. And when you consider, I forget which one of them, but one of them has to be stored at -50 degrees Fahrenheit. So one, that requires a very expensive freezer that's not easy to transport. So when you think about small rural areas like where I am, that's a significant factor. But there's also the factor of it has to thaw for 2 days. So you have to thaw exactly the right amount for exactly when you need it. If you thaw too many, you've wasted vaccine. If you don't thaw enough, you're not effective in the community. So it's not like the flu where you can just go out and blitz and give it to everyone. There's a lot of planning that is going to go into this vaccination process. So that's another reason why I'm cautiously optimistic, but I know this vaccine is not an end all. Fauci is not hopeful that we'll be back to normal until 2022, and I'm not either.
It honestly makes sense, because the whole world is going to have to essentially get this vaccine. And, obviously that's going to take some time. And so I don't know. I know there's like 3 vaccines right now that are being rolled out, being tested, and, everybody's getting closer to getting it, but, I don't know. It's just, it's exhausting at times, but I do have to commend you for sticking out for sure. So since you're in the track and tracing, will you also be involved in the vaccine distribution as well?
They haven't. That's still. I've been in meetings about planning that. My role as a public health nurse, then yes, I would definitely be involved in vaccine administration. Not so much because I'm in contact tracing, but as a public health nurse. I mean, that's part of my normal role right now is, the vaccine campaign. So COVID, whenever the vaccine is widely available, that's our number one priority.
I've been following on social and have seen that, you've been in the hospital at times. Can you kind of tell me why you were called there and kind of what you did while you were there?
The why is just a simple, they need as much help as they can get. Just like every hospital in the country right now is literally all hands on board. And I'm an RN and was ready to jump in. What we were seeing in the hospital is it's a lot and it's intense and it's just a lot of people struggling to breathe and a lot of super sick people. And everyone's stretched super thin and stressed out and doing everything they can for every patient, but resources are limited. And it's a lot of patients in respiratory distress, which is incredibly stressful. And I think people underestimate the emotional toll that takes on a person. Is caring for that many people. If you think of the concept of someone struggling to breathe and dealing with that, it takes a toll on you. I read an analysis lately that was really interesting that said 10 to 20% of COVID cases are responsible to 80 to 90% of the infections. So what that says is it's not just if I have it, it's not the way it's spreading isn't me spreading it to 2 or 3 people. It's the main reason it's spreading is super spreader events. It's people that have it and then are attending parties and giving it to 20, 25 people. And then they'll give it to 1 or 2, but then one of those will give it to 20, 25 people. So when you think about 10 to 20% being responsible for nearly all the infections, there's literally so many easy things we could be doing to stop the spread of this. Like not having parties, not going to weddings is the least that we could be doing right now. I don't think that's that drastic.
Yeah. I had a friend, she actually canceled her wedding that she was planning on doing in July and moved it till next year.
Yeah.
Hopeful, she's like one of my best friends, we're hopeful that maybe we'll be able to, do it. But she did it because a lot of the people that were planning on going, were vulnerable people. Like they were older people, and that's the people that you have to, shield this kind of stuff from. And so I don't know. It's a crazy thing, but yeah.
And that's a totally valid point, and you're completely right. But I think so you say that vulnerable people attending, but then what people don't think about is what happened. I had this year. There was a birthday party that happened, and a bunch of people attended the birthday party. That birthday party caused 2 deaths of people that didn't even attend the birthday party. They weren't even there. Mm-hmm. So it's not just, if you attend a wedding, attend a birthday party, it's not just vulnerable people attending. It's also contributing to more than that. Because, those 2 people died and they didn't even go to that birthday party. So, those 2 people did everything they were supposed to do, and they still lost their lives because this birthday party happened. So things like that are what makes me want to bang my head against my desk all day.
I guess, is there any kind of advice as things move forward in terms of the vaccine, what everybody should be expecting this coming year?
Well, I think everyone asks, all my friends and people that follow me on social media are ask me so, they ask me one, is COVID really that bad, or is it all the media? It's really that bad. It's not the media. 2, they ask me about the vaccine, whether or not I think it's safe. I, as a human, I research it thoroughly, obsessively, even on my own free time. I 1000% think it's safe. I will be getting it as soon as it's available. I have recommended it to everyone that I love, that I want them to get it as soon as it's available. And I would recommend anyone watching this to get it. And the rest is just, what we've been told for 9 months now is please, please, please wear a mask, social distance, frequent hand washing.
Well, thanks again, Taylor, for speaking with me. I really hope you stay well and continue to, stay as positive as you can going through this. And really appreciate you again speaking with me. But hope you stay well.
Yeah, of course. Thank you for having me.
Yeah, no problem.
If you would like to hear more stories like Nurse Taylor's, please don't forget to subscribe below. Thanks again for joining me. I'll see you next time. Stay safe, remember social distancing, and follow your government's guidelines on the COVID-19 pandemic.